Every time you avoid the business conversation, someone else defines your value. That is the hidden tax most physiatrists are paying. You train for years to restore function, reduce disability, coordinate complex care, manage outcomes, and lead rehabilitation teams. Yet many physiatrists still feel uncomfortable discussing compensation, ownership, contracts, medical directorship terms, billing structures, referral strategy, or practice growth. So what happens? Hospitals need you, patients need you, post-acute systems need you. But the physician who does not understand business often gets treated like a replaceable service line instead of the revenue producing, outcome driving leader they actually are. That gap is expensive. The demand for physiatry is not slowing down. Aging patients, stroke recovery, spinal cord injury, brain injury, joint replacement, debility, chronic pain, neuromuscular disease, and post acute complexity are all increasing. But here is the squeeze: more patients, more documentation, more compliance pressure, more administrative demands, lower reimbursement, less margin for error. And while physiatrists are working harder, many still do not know how to convert their clinical value into business leverage. That is where fear creeps in: fear of asking the wrong question, fear of sounding greedy, fear of losing the opportunity, fear of not knowing enough, fear that other physicians are already building profitable practices while you are still trying to decode your contract between consults. That fear is real, but fear is not the enemy. Silence is. The good news is this: speaking up is not a personality trait, it is a practice. Just like gait training, procedural skill, documentation accuracy, or team leadership, it improves with reps. You do not start by negotiating a seven-figure partnership on day one. You start with smaller business sentences. Can you clarify the compensation formula? What happens if collections exceed projections? Is there an opportunity for equity participation? How are medical director duties defined? What metrics determine bonus eligibility? Who controls staffing, scheduling, and patient assignment? These questions are healing because they restore your professional confidence. They are hopeful because they show you there is a path beyond burnout. They are helping because they protect your future patients, your family, your practice, and your autonomy. The physician who can clearly ask business questions eventually becomes the physician who can negotiate, lead, own, scale, and build. Here's the hard truth: if you do not learn the business of medicine, you do not avoid business. You simply become subject to someone else's business model. Someone else decides your productivity target. Someone else defines your worth. Someone else captures the upside. Someone else owns the infrastructure. Someone else controls the patient flow. And you are left wondering why you are exhausted, underpaid, and watching non-physicians make decisions about care delivery while you carry the clinical responsibility. That is not sustainable. Physiatry is too valuable to be passive. This specialty sits at the center of function, outcomes, throughput, post-acute strategy, length of stay, discharge planning, readmission reduction, and patient independence. In plain English, physiatrists are sitting on a gold mine of value, but too many are holding a plastic spoon. So here is your challenge. This week, speak up once in a small business moment. Ask one question you would normally avoid, clarify one term, challenge one assumption, request one metric, review one clause, say one true sentence instead of the safer, softer version, because profitable practice ownership is not built by physicians who know everything. It is built by physicians willing to learn the business, ask better questions, and stop apologizing for wanting ownership of the value they create. You do not need to become aggressive, you need to become clear. You do not need to become arrogant, you need to become informed. You do not need to wait until you feel ready. You need to start getting reps. That is how speaking up becomes leadership. That is how leadership becomes leverage. And that is how leverage becomes a profitable physiatry practice built on your terms. If you are a physiatrist who feels the pressure rising, more demand, less reimbursement, more responsibility, less control, this is your sign. Do not stay quiet while your future is being negotiated without you. Speak up. Your practice depends on it.